nimewahata manze, miss. Today is on Wednesday morning. That's why I'm saying good morning. Like nimetoka tu tizi nikakam na najirecord na simu. So this wasn't supposed to be today's episode. Nikasema nifanye stories, nikaona it's too long for stories. So last week Dr. Monda alikama akatuchanua. Cele's reflection tulisema tukichanuliwa, if it works you try, if it doesn't hivyo ni experiences za msee. So me last week nilichanuliwa na Dr. Monda and I decided to go and have the pap smear test. I'm still waiting for my results. I am scared, but I did the test. Nachani niwaambie kama kuna msee anakuanga muoga ni Cele. Lakini manze mnafanya naacha kuwa muoga. Yani Cele's reflection inafanya natoka out of my comfort zone. Inani push, which is good. It is not bad. So I went for the test and najua mnataka kujua nilisikia aje. Well, si uchungu, sikusikia uchungu. For me, sikusikia uchungu. But I felt uncomfortable. Ile tu ya kawaida, ile tu, you know, hivyo tu. It just feels, it's not a good feeling. Atinaweza penda kila saa nafanya. But you see again, doctor alisema once a year. Once a year for 2 years, ukiwa na uko sawa, once every 2 years. So me, I did my first one, my very first pap smear test. Nilienda, and that's how I felt. No pain at all. Juu inapakwa gel, insertiwa with the gel, so it slides in, but just discomfort, uncomfortable. Yes. But that doesn't mean at usiende juu Cele alisema ni hiyo tu, it's a feeling you will feel. Wewe utasikia zako, mimi nitasikia zangu, but I didn't feel any pain. Na nilikuwa nimeogopa. So nikasema badala ya kuweka episode yenye ilikuwa inafaa ikuje leo, wacha kwanza tu follow up na hii. Because doctor alipeana offer. Alisema Celestine, tell your Cele's reflection team mwenye atakuja nitamlipisha 2K for the test. Just 2,000 bob. Aingie, afanye hiyo pap smear test, apatiwe results. No consultation, just the test. Consultation, if you feel you have other issues, like you want to see doctor is open for any other thing. But sasa utabook kama mgeni wa kawaida, ulipe consultation, ulipe matibabu. But for this test, alisema watu wako Cele na wapatiana 2K na wafanya test na watumia results. Bas. So here is my video. Nilikuwa nimerecord niweke kwa stories, but it's too long. Na it has more information. Nikaona, why not? That's why I'm filming with my phone and I'm recording myself today morning. Ndo niweke hii episode. At least mwenye ata feel, ka Cele alienda. Juu mimi nakuanga kaoga by the way. Ka Cele alienda, wacha niishie. Kama Matugi alifanya, hata mimi acha nifanye. It's never too late. Yes. So here's my experience.
For us medics, you know, it's an invasive process.
True.
It's so even for us who push you to have pap smears done on a regular basis, we also need to prepare ourselves psychologically. Okay.
Yeah.
Because this is an examination that is actually invasive in the sense that I'm having to put a speculum, this, in the vagina. Okay. But once what we encourage you just to relax, because you have to do it.
Yeah.
Okay. We encourage you just to relax, and it's a very quick process.
Okay.
It's a very quick process.
How many minutes roughly?
Probably about 5.
Okay.
And by the way, it will be over before you know it.
True.
Okay. It will be over before you know it.
Okay.
So let me explain what happens. So this is a model of the uterus. Oh, sorry, of your reproductive organs. This is the vagina. This is the uterus. This is the lower part of the uterus, the cervix. These are the fallopian tubes, and those are the ovaries. So what we do, this is where the process of the pap smear takes place. So we put this, what we call a speculum. And what most of us use nowadays are plastic disposable speculums, so that we use, if they're sterile, we use and we throw. Okay? So we insert this.
This is what you're going to insert?
Yes,
okay.
But only this bit.
Okay.
Okay? Because this allows us to open.
Okay.
See, it's got a hinge mechanism.
Okay.
So we insert this into the vagina that way. Okay? So once it's in the vagina, we turn it round and then we open.
Okay.
When we open it like that, it gives us access to the cervix. Okay? It gives us access to the cervix. There. Then what we do, we take this brush. This is what it looks like. And then we roll it in the mouth of the cervix. Okay, we roll it in the mouth of the cervix. It's like taking this brush and brushing the inside of your mouth. Basically the same thing. That gives us cells that we pick from the mouth of the cervix. Okay, we take that and we smear it on this glass slide. Okay, then we fix it with this chemical. There's a chemical in here, and that's a pap smear.
Wow.
It's a 2-minute thing.
Then the results are out immediately.
No, they're not. I send them to a pathologist. That is now a doctor who has studied this kind of medicine, this bit of the medicine, okay, investigations. So the pathologist or a cytologist will look at that. There's a stain that they put, and then they look at it under the microscope, and then they will tell us whether there are any abnormal cells or not. So basically what a pap smear does, we are screening for abnormal cells in the cervix. Okay, so when there's a way we grade them. Okay, there's a way we grade them. So when we tell you have a normal pap smear, it means we did not pick anything that is suggestive of cancer. We may pick up other things, like maybe you may have thrush, candida, or yeast. There may be a bit of inflammation, but a lot of that, it's not an emergency procedure that we would want to have to do in pregnancy.
Okay.
So if you're heavily pregnant, no.
Just wait.
We wait, you have your baby, and we can always do it after 6 weeks after delivery.
Okay.
Or a bit later.
Okay.
Yeah.
Now I'm ready.
Okay. Now, how do you prepare for a pap smear? There's some very basic things. I usually make it very simple. We don't do pap smears when you're having your period, okay? Because the blood will mask the cells that we pick. So ideally, you give it like about a week from when your period has ended. So that way we're absolutely sure that you're dry. We encourage you also not to douche. Don't wash inside the vagina. Abstain from sexual intercourse for at least 48 hours. Don't use spermicides or any vaginal, any treatment that you put in the vagina, because that can also change the picture of the pap smear. Okay.
Okay.
Yeah. Now, what we're able to get rid of them, and that is why we say cancer of the cervix is 100% curable, caught in its early stages. Yeah.
So that's why we're telling them it's important to have these pap smears done.
It's important for you to have your pap smears done regularly. Now, for any woman who has become sexually active, when you start doing your pap smears, immediately you become sexually active. Because remember, cancer of the cervix is caused by the human papillomavirus, which is sexually transmitted. So if this is your first pap smear, ideally you should do it yearly for the first 2 years. If those are normal, then after that you can have them done every 2 to 3 years. Now, guidelines differ. You may go to Europe and they tell you something different. You go to the US, they tell you something different. Maybe South Africa, they tell you something different. But what we always do, for me, I encourage my patients to have a pap smear done on a yearly basis, because it's what usually happens, at least every 1 to 2 years. What usually happens, you'll do it now and then decide, okay, you've done it, maybe wait for another 2-3 years. Before you know it, 5 years, 6 years, 10 years have passed. And that happens quite a bit. So you remember you did a pap smear maybe 5-10 years ago, and then when you come, we find that actually there is a problem that was missed because you didn't do your pap smears on a regular basis. Now, cancer of the cervix is actually a silent cancer. By the time you're developing symptoms, that disease has already grown and spread. Okay? Because remember, this is where it starts. Okay? This is where it starts, and then it spreads. So by the time you're having the symptoms of an abnormal vaginal discharge that is foul smelling or blood-stained, by the time you're having pain when you pass urine, or when you're having sexual intercourse, the disease is actually quite advanced. Okay, so you can imagine that very simple test that you do on a regular basis is actually life-saving. Yeah.
Sure.
And then another thing, Celeste, it's good for you to know, cancer of the cervix is a leading cause of death due to cancer in our part of in sub-Saharan Africa. They say breast cancer, but we pick up cancer of the cervix more. It's a disease that is prevalent actually in the lower socioeconomic groups, because they tend to not go for screening. Okay, and if you remember in your program, I mentioned the main cause is actually the human papillomavirus type 16 and 18, which are sexually transmitted, and HPV, or the human papillomavirus, is a commonest sexually transmitted infection in young men and women of reproductive age below the age of 30. Now, in 90% of people who pick up the infection, their immune systems will clear the virus, but it's in the remaining 10% who have persistent infection who will then eventually develop cancer of the cervix. But the thing is, you'll never know whether you fall in the 90% whose immune systems will clear the infection, or in the 10% who will have persistent infection. So that is why it's important for you to have these checks done on a regular basis.
Yeah. Better safe than sorry.
Yes.
Okay.
Okay?
Yes.
Celeste, it's unfortunate. We don't talk about our reproductive systems much, or our reproductive health. There's an element of stigma, especially in the older generations. So you'll find they will start having symptoms, but they don't know how to tell their children, I have started bleeding, I am having a discharge. So you'll find many times by the time they're actually getting to hospital, where somebody actually picks up the fact that there is a problem, it's way too late. So this is information we need, not just for ourselves, not just for us younger people, but for even the older generations. Make sure that get your mothers checked, get your aunties checked, disseminate the information, get your grandmothers checked, because we need to screen on a regular basis. This disease is prevalent in this part of the world, and it's 100% curable, quote, in its early stages. So it's not just about us. We need to also give the information out there.
Yeah. Okay. Yes.
It's not painful.
It's not painful.
How did you feel?
It's not painful, like nilikuwa.
Na wewe ni wale waoga.
Well, I was so tensed, baby. I was so tensed, but
You can see it's just 2 minutes and we're done.
yeah.
Something I forgot to mention, you empty your bladder at least 15 minutes before we do the PAP smear.
Well, I did that so many times.
And
I
then,
was running to the toilet every now and then.
another thing, when we're doing a PAP smear, by the way, we take that opportunity to also inspect the external area in the vulva, and then we inspect the vagina, we inspect the cervix, is when we do the PAP smear. So there's a lot more to a PAP smear than just taking that
So
sample.
it's a plus.
Yeah.
Oh, like you can, okay, yeah.
So that's when we pick up things like maybe a patient may have some candidiasis, which we treat. They may have a small growth on the cervix, which we're then able to sort out. They may have, they may be bleeding. You know, there are very many small things that you can actually pick up. They may have warts that are hidden. Yeah.
Okay.
Yeah. So, but then of course the most important thing is it's a screening test for cancer of the cervix, and it's important to have it done regularly.
Wow, let's wait for the results.
Okay.
Yes.